It's always a pleasure having you tuned in on Church of Uganda Family TV. I welcome you to HealthPot. HealthPot is a program brought to you by Makerere University School of Public Health together with Church of Uganda Family TV. And what do we consider here? We look at early childhood development, maternal and child development, but also other public health concerns. Now, which are these public health concerns? Just keep it on HealthPot. Here we are. We have an issue which is very, very pertinent when it comes to our daily lives. Now, Edrine Osteen Mukalazi is my name to introduce to you today's topic. And we have an exciting guest who you need to know. What are we looking at today? We are looking at the state of road safety in Uganda. And who do we have? We have Jimmy Osuret. Jimmy is a researcher, an injury researcher with Makerere University School of Public Health. So we are talking to the right person to address issues to do with injuries and accidents. He told me they're not accidents, they are crashes. So he will tell us why they are crashes and not accidents. Jimmy, you are most welcome on HealthPod. Thank you so much for giving in this time to share with us.
Thank you very much, Edrine, for the introduction. I like to start by commending Family Television for the programs, but also the development of content that empowers communities out there, and specifically this show, the HealthPot. Thank you very much.
Wow, so to start off immediately, why do you think road traffic injuries are a concern in Uganda today?
So I like to start by saying that they are of public health concern because of the burden. And the burden in terms of the number of people who are dying on our roads. Just this year alone, I lost a cousin due to a crash. And this speaks to the fact that we need to do something about these crashes. But beyond the death, we have those who survive from the crashes and end up living with disability. And this reduces on their performance, it reduces on how they go with their day-to-day activities. And even beyond that, the cost of treating injuries is quite high. From a study that was done, it could cost up to 7 million shillings to treat an injury. So this is why this topic of road traffic crash injuries is quite of concern.
So why you as a researcher, why do you refer to them as crashes and not injuries? Because someone watching us would need to know why.
So we call them crashes and not accidents because we do believe they are preventable. Road traffic crashes are preventable. We know what works well to prevent them. That's why we are moving away from the term accidents to crashes.
Okay. So we talked about why it is a concern today, but then why is it a burden globally? We now let us first look at it globally, then we shall reduce it to Uganda specifically.
Okay, thank you that you asked that. From the Global Status Report, which documents the burden of injuries throughout all countries in the world, it shows that more than 1.35 million people die on our roads, that is every year, due to road traffic crashes. And specifically, if you are to look at in line with other diseases, road traffic crashes are the #1 killer of children and adults, that is ages 5 to 29 years, that is globally. So what this is telling us is that road traffic injuries have surpassed many infectious diseases in terms of the death that it's causing out there.
So we now look at we look at we reduce it to Uganda. We look at it globally. Now we want to reduce it to Uganda. How are the statistics? I remember the month of October, the police came up with a report and said that 4 people die every day because of border accidents. Now, if you calculate that from 4, a week, a month, and now a year, that is only with borders. What about the taxis? What about the buses? What about the saloon cars and cabs? So, what are the statistics as you are a researcher?
Okay, thank you that you asked that. First of all, the source of this information is the road traffic crash reports. The traffic police routinely collects information on the crashes. And in their latest report, it shows that in 2021, over 4,159 people died on our roads. And if we were to look at the percentage in terms of who constitute the most, it is the pedestrians, the people who walk, as well as the commercial motorcyclists, the one we refer to as the border riders. Specifically, the pedestrians, we had an estimated 1,384, that is 33%, who are pedestrians who died on our roads. Then for the borders, we had about 1,390. But Edrine, I must say that this number is an underestimate because not all people who die on our roads, not all that information is captured. We have some information that is missing. So in reality, we have the numbers could go up to 2 times, up to 3 times the 4,159. But still with the statistics that are coming out, it shows us that it is still a burden. If you're to do the mathematics, those are about 11 people who die every day on our roads. And we are getting concerned that this issue is not receiving the utmost attention that it deserves. If it was another condition, say an infectious disease, we would have everyone on board to deal with it. Yes.
So what does it take for a road traffic crash to occur?
So for a road traffic crash to occur, there are quite a number of factors that have to be in play. Many times when a crash occurs, the reports are attributed to reckless driving, to carelessness. But beyond that, there are other factors that we need to know.
I think we first disseminate what is termed as reckless driving, because he who recklessly drives doesn't know that they are recklessly driving.
Yes. So they may not know they're recklessly driving.
They think they're driving the right way.
Yes. So reckless means you are violating. You're violating the road rules that are in place. For instance, if you are at a traffic lights signal, if the traffic light signal is red and you jump the traffic light, that is an example of reckless driving. So beyond the reckless driving, we need to know the contribution of the road environment. The road environment also has a role to play in causing these crashes that we see. For instance, many of our roads are single carriage, which is why we have a number of head-on collisions with a few opportunities for overtaking, issues to deal with blind spots or sharp bends. These are likely to increase the risk of a crash occurring. Even the geometry of the road. Recently, you've been seeing the Ntinda stretch having a number of crashes involving the trailers and the heavy-duty vehicles. So what is it about that industry? Is it that it is too steep for those trailers to navigate? So these are some of the things that we also need to know beyond the road user behavior are contributing to crashes. And also there's another factor that comes in play. That is the vehicles that we are using. How safe are the vehicles that we are using? Usually there's what we call star ratings for vehicles, and it's based on the safety features of these vehicles. So at times maybe the heavy duty vehicles may fail to brake as they're descending down a slope, and that could also cause the crashes. So by and large, for a crash to occur, the behavior, the road user behavior contributes a percentage, the road environment contributes a percentage, as well as the vehicle. So all those three have a role to play.
So you've talked about the road user, the road environment, and the vehicle itself. And there are features you've not talked about, especially on the vehicle user. Besides reckless driving, what other mistakes do vehicle users do that cause crashing?
Okay, thank you that you raised that. An instance, if we are to look at our highways,
Yes.
Why would you be driving at over 140 kilometers per hour on our highways? And yet we have busy trading centers, we have crossroads. So speed is one of the risk factors as to why we see these crashes occur. And we need to find ways of dealing with speeds. All passenger vehicles, or all vehicles that carry passengers, the buses, the 14-seater, commuter taxis, should drive within the recommended speed limits, and we shouldn't leave it to the drivers. We have technologies that are in place. We could put speed governors on these vehicles to regulate the speeds and deal with the issue of speed. So speed is one of the risk factors we see related to the behavior.
Yes.
Also drink driving. Following the COVID restrictions, nowadays it's difficult to apply the breathalyzer tests, but we need to think of ways on how to curb that vice of drink driving. If you abuse drugs, that means you're not going to be performing well and you're not fit to operate these vehicles. And also beyond that, issues of helmet wear and the borders moving without helmet wear.
And this time the police is actually so stiff on borders. HealthPot is a program brought to you by Makerere University School of Public Health with Church of Uganda Family TV, and we basically look at early childhood development, maternal and child development, but also we look at other public health concerns like the one we are looking at today. We are looking at the state of traffic injuries in Uganda, and we have an interesting conversation with the one Jimmy, who is a researcher with the Makerere University School of Public Health. So Jimmy, we are back from the commercial break, and before the break you had brought in something that is patent. When the police came up, when the traffic police came up with a directive that it is now mandatory for all border riders to have helmets and reflector jackets. Some people didn't know why they need them, why they need the helmet and why they need the reflector jackets. But I think you're providing an answer to someone who might be wondering why the police is exerting a lot of pressure on them to put on these helmets.
Thank you, Edrine, that you raised that. Actually, the measures that have been put in place are to the benefit of the border riders.
Not the officers.
Not the officers, no. First thing is that in the event of a crash, this helmet is able to protect you from head injuries. But also, we should go a step further and also see to it that the passengers also wear helmets to protect them too. It shouldn't be about the riders, but also the passengers. Then concerning the reflectors, these help with visibility. Remember, the motorcycles have issues of conspicuity.
Yeah.
You're unable to see them coming from a bend, so the reflector helps you at least see them. But even beyond that, in the evening hours when the visibility is poor, these reflectors help with that. So these measures are all put in place for the safety of the riders, but also we need to encourage that the passengers wear. The other thing I want to say is the quality of helmets
that is very important, because when a directive comes up, we tend to buy any helmet you find on the market.
Yeah, so yes, we need to see to it that first of all, the helmets that are in the market are of a quality that will protect those who use it. They should have a strap, it should have the shield, and it should have passed the tests. The Uganda National Bureau of Standards carries out tests to ensure that they can absorb the shock in case you hit the ground and protect you from head injuries.
So as a layperson, how do I know that this helmet passed the test when I find it on the market? Because it is very possible that there could be helmets that didn't pass the test, but then are they on the market and people are buying them.
Oh yes, actually there was a study that was done as an attempt to answer that, and it was found out that people do not know what a standard helmet should be like,
yes,
and what they should look out for, which is why we should hold accountable the responsible authority. First of all, to have helmets that pass the test, to be certified, to have a Uganda National Bureau of Standards stamp, but also at the points of entry into the country, we should regulate the helmets that are coming in, such that we don't leave it to the buyers to choose which is standard or which is not standard. So if we're to sustainably have quality helmets in the market, we should regulate the importation of unsafe and substandard helmets, as opposed to leaving it to the consumers.
So looking at still borders, what do you think can be done about the high burden among border riders? We are looking at the burden of the traffic injuries.
So I like to take you aback and look at our public transport system, if we are to understand why the borders have really mushroomed in our city. So we do not have a viable public mass transit transport system, a transport system that ferries more people. These are the buses,
Yes.
these are the commuter trains. And looking at the population of the city, you cannot move 3.5 million people out of Kampala using two-wheelers, using the borders. So the reason why the borders have come up is because of the lack of a viable mass transit. So people are using it as an option, and that is not sustainable. If you're to look at the statistics, 70% of the population in the next 10 years or so are going to be living in cities. And to effectively deal with mobility of such a big number, two-wheelers or commercial motorcyclists or private cars are not sustainable. So we need to move to mass transit. The fact that they are not planned for would explain why the crashes are higher among that group. And also, secondly, they are not regulated. I do believe a transport system that is regulated and is held accountable and has a way of operating could actually reduce the crashes. I'm happy there are some programs that are coming up trying to regulate the border industry. There are associations that are putting borders together. I think we have Safe Border and others. You'll notice that they try to help to clean up. So I suggest we have a transport system that prioritizes moving more people. Then the borders can be integrated to connect people maybe to their households. But within the city center, let us prioritize mass transit.
So Jimmy, we know this is a very busy season where people travel a lot to villages, but also this is also a season where road accidents are high, road crashes are high. I learned that term. So what do you think can be done? There are long-term solutions that can be done to address the burden of the road safety burden in Uganda.
I thank you that you raised that. There is what has been prescribed by the UN Decade of Action for Road Safety 2020 to 2030 to try and reduce the number of deaths on our roads by 50%. They recommend what we call a safe systems approach that looks at 5 pillars. So the first pillar is what we call the multimodal transport, and in this we need to promote mass transit that I had earlier on spoken about, a transport system that carries more people, but also make provisions for safe cycling and safe walking. The second pillar deals with the infrastructure, the roads that are being built. We are suggesting to UNRWA, to the Ministry of Works and Transport and the local governments that before a road is commissioned, it has to pass a road audit to ensure that safety features are in place. These could be guardrails to prevent vehicles from veering off the road. These could be speed humps, especially in areas that have heavy pedestrian density, and also trying to separate oncoming traffic to reduce on the head-on collisions. Beyond the infrastructure, the other pillar, which is the third pillar, looks at the vehicles. So we suggest that vehicles that are operating our roads should have safety features in them. These safety features are technologies that reduce the outcome in the event of a crash. Technologies such as the airbags, crash avoidance, and one of the suggestions we are putting forward is to see to it if you can negotiate that the taxes on vehicles are subsidized, such that for the same amount of money you can be able to buy a vehicle, newer vehicle that has actually safety features to protect people in the event of a crash. I'm happy that institutions such as ministries have vehicles with good safety ratings. The fourth pillar deals with issues of post-crash response. In the event of a crash, what care do you receive? We call that pre-hospital care that you receive. And it's actually time sensitive. It will determine whether someone will live or die. So it has to be quality care, and the person has to be evacuated from the road scene to a health facility and dealt with. Yes.
Wow, as we wind up this program, Jimmy, it has been a very nice and eye-opening session. So what are your closing remarks on the issue of road safety?
Okay. First of all, road safety is a shared responsibility. Everyone has a role to play, from our lead agency, which is the Ministry of Works and Transport, to academia, the research institutions that produce evidence on what has been shown to work, to the civil societies that are playing a role in advocating for safer roads, to even the public. We need to hold accountable everyone if we are to sustainably deal with the issue of road safety. And I would suggest that if we are to sustainably bring down these road traffic crashes, we need to address each of the pillars I've shared about: issues of multimodal mobility, issues of road user behavior that has aspects of enforcement of the risk factors, issues of vehicle safety, issues to deal with post-crash response, and most importantly, the infrastructure on the roads. Thank you very much.
Wow, thank you, Jimmy, for sharing with us this, and we look forward to having you again to share with us such important information here on HealthPot. And to you, our viewer, it's always a pleasure having you on HealthPot. HealthPot is only on Church of Uganda Family TV every Friday at 7 p.m. and it's brought to you by Makerere University School of Public Health together with Church of Uganda Family TV. Edrine Osteen Mukalazi is my name, your host. We had Jimmy Osuret and Mebo Murungi, our sign language interpreter. Jonah Jal, the producer, and Mumuza in transmission. God bless you until we meet again next time.